Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Eponyms named after the Friedrich, Trendelburg. So first one is the Trendelburg sign. So this is a sign demonstrated by asking the patient to stand on one leg. And when the patient stands on the affected limb, the pelvis severely drops. So it severely drops, and the patient, when stands on the affected limb, the pelvis drops. So after drops over the swing limb. So the pelvic drops over the swing limb. Next, this is seen in the paralysis of the gluteus medius and the minimus. So then comes the dislocated hip, the fracture of the neck of the femur. Then comes the Trendelburg gait. So what's happening in the gait? The gait is seen in patients with the Trendelburg sign. The body swings on the opposite side every time when the weight is borne on the same side. So body swings in opposite side. Opposite side when the weight is borne on the same side. So weight is on the same side. Next is the Trendelburg position. Trendelburg position is the position in which the patient is placed on a bed, which is put in the incline such that the patient's head is lower than the feet. The head is lower than the feet, and then comes this is also known as a head down position. It is a head down position. Next is the reverse Trendelburg position. So reverse Trendelburg position, what is it? So this is a position in which the patient is placed on a bed and which is put into an incline such that the patient's feet are lower than his head. So feet is lower than the head. This is known as the head up position. Then is the Brody's Trendelburg test. So it is a test presents the incomplete valves in the lower limb. So incompetent valves of the lower limb. To learn and grow daily like this, please do subscribe.